Foliates. So the important term that we need to remember under foliates is known as methotrexate, which is the classic antimetabolite of folic acid structurally derived by N-methylation of the para-aminobenzoic acid residue and replacement of a pteridine hydroxyl by the bioisosteric amino group. Methotrexate has a huge role when it comes to associating folates as antimetabolites useful for drug therapy. Under that, we have the term known as methotrexate 66, which is a broad spectrum antineoplastic agent which is commonly used in the treatment of acute lymphoblastic and myeloblastic leukemia and other lymphomas and sarcomas. So the acute lymphoblastic and myeloblastic leukemia disease, these are both cancers of the blood which mainly affects the production of red blood cells, platelets, and the production of lymphocytes. And the major side effects seen are bone marrow suppression, pulmonary fibrosis, and GI ulceration. And another term that under the foliates is known as leucovorin, which is often given 6 to 24 hours after methotrexate to prevent the long-term effects on normal cells by preventing the inhibition of DNA synthesis. And next is the structure of folic acid and antifoliate anti-cancer drug. So here we have the structure of folic acid, methotrexate, pemetrexate, and trimetrexate. So first is the folic acid. So folic acid usually help to maintain or to make healthy red blood cells which carry oxygen around the body. So this is the structure of folic acid. Next is the methotrexate. Methotrexate is used to treat certain types of cancer or to at least control severe psoriasis or rheumatoid arthritis that has not responded to other treatments. So this is the chemical structure of methotrexate. Next is the pemetrexate. So this is used to treat certain types of cancer, specifically lung cancer. And this drug works by slowing or stopping the growth of cancer cells. So this is the structure of pemetrexate. And lastly, the trimetrexate, which is the lipid-soluble analog of methotrexate that has been used in the management of pneumocystis jirovecii in patients with AIDS and also used for other therapy. So this is the chemical structure of the trimetrexate. Next is the other related compounds, product, and or drugs related under antimetabolites. First, we have the drug known as capecitabine, or also known as Seloda. So this drug is a fluoropyrimidine carbamate prodrug form of 5-fluorouracil with the initial of 5-FU. And this drug is commonly used to treat breast cancer and colorectal cancer. Next drug is known as citarabine, or also known as cytosine arabinocyte, ARAC, or cytosar U-tarabine. And this drug is used for the treatment of acute myelogenous leukemia and CML. And this drug is a deoxycytidine analog, originally isolated from the sponge of Cryptotheria crypta. The next drug is known as floxuridine, or also known as fluorodeoxyuridine with the initial of FUDR. And this drug is used to treat metastatic GI adenocarcinoma, and the mechanism of action of this fluoropyrimidine deoxynucleoside analog involves metabolic conversion to 5-FU metabolites. Next drug is the gemcitabine with the initial of DFDC, or known as Gemzar. So this drug is used to treat bladder cancer, breast cancer, and pancreatic cancer and NSCLC. This is a potent radiosensitizer and increases the cytotoxicity of C-plastin. And the mechanism of action of this fluorine substituted deoxycytidine analog involves the inhibition of DNA synthesis and function via DNA chain termination. Next drug is the cladribine, or also known as 2-chlorodeoxyadenosine 2-CDA, or also known as lustatin. This drug is used for chronic lymphocytic leukemia, hairy cell leukemia, and non-Hodgkin's lymphoma. And the mechanism of action of this purine deoxyadenosine analog involves the incorporation into DNA, resulting in inhibition of DNA chain extension and inhibition of DNA synthesis, and as well as its function. Another drug is known as fludarabine, or also known as 2F ARA AMP, or known as Fludara. So fludarabine is used to treat chronic lymphocytic leukemia and non-Hodgkin's lymphoma. And the mechanism of action involves the triphosphate metabolite and its inhibition of DNA chain elongation. Another drug is known as mercaptoporin, or known as C6MP, mercaptoporinum, or known as porinitol. So the primary uses of this drug is for the treatment of lymphoblastic leukemia, acute lymphocytic leukemia, and Crohn's disease. And the mechanism of action of this includes the incorporation of mercaptoporin into the DNA and RNA via the triphosphate metabolite. Next drug is known as thioguanine, or also known as 6-thioguanine, or 6-TG, also called as tabloid. And this is used to treat acute non-lymphocytic leukemia. And the primary mechanism of action involves incorporation of the triphosphate into DNA and RNA, resulting in inhibition of processing and its function as well. Another drug is the pentostatin, or known as 2-deoxycoforomycin, with the initial of DCF, also known as Nipent. So this drug is used to treat leukemia such as hairy cell leukemia, also chronic lymphocytic leukemia, and lymphoblastic leukemia. And the primary mechanism of action involves inhibition of enzyme adenosine deaminase, yielding increased cellular levels of deoxyadenosine and deoxyadenosine triphosphate, or known as DATP. Next drug is known as methotrexate, with the initial of MTX, also known as abitrexate, mexate, or folex. So this drug is used to treat several cancer types, including also breast cancer, bladder cancer, colorectal cancer, and head and neck cancer. And the mechanism of action of methotrexate involves inhibition of DHFR, leading to a depletion of critical reduced folates. Another drug is known as pemetrexed, or with the initial of MTA, or also known as Alimta, ALIMTA. So this drug appears to be effective against a range of tumors, including mesothelioma and SCLC, colorectal cancer, bladder, and lung cancer. And the mechanism of action involves inhibition of TS, resulting in inhibition of thymidylate and DNA synthesization. Another drug is known as trimethoxate, or known as TMTX, or Nutrexin, and this drug is used to treat colorectal cancer, also head and neck cancer, as well as NSCLC. And the mechanism of action of this of the trimethoxate involves the folate antagonism and inhibition of thymidylate synthesis. And the last drug is known as hydroxyurea, or known as Droxia or Hydrea. and this is often considered an antimetabolite drug, and it is used to treat myelogenous leukemia as well as ovarian cancer and essential thrombocytosis. And the primary mechanism of action of hydroxyurea involves the inhibition of DNA biosynthesis by inhibition of the enzyme ribonucleotide reductase.